So in the next 15 minutes, I'll be talking about orthogeriatric care in the Asia Pacific region. I have no financial conflicts related to this talk, although I have to give the acknowledgements to the due persons. And this will be the outline of my presentation. I'll be talking about fragility fractures in the aging population. Give the reasons why the treatment of patients with fragility fracture goes beyond the fracture fixation, and identify the extended role of orthopedic surgeons within the orthogeriatric management, which I think we've been mentioning during the last 1.5 hours. And lastly, I want to say about the global call to promoting orthogeriatric care amidst the challenges, and relate some of our own local experience. So much has been said regarding the burden of osteoporosis and fragility fracture. I just want to reiterate that like 3 years ago, in a sub-study based on the International Orthopedic Multi-Center Fragility Fracture Study, among female patients, the most significant source of fracture burden in the elderly was to be fragility fractures, such as hip fractures. And in this study, it included low to middle income countries, which included countries in the Asia Pacific region. Okay. During the time of the pandemic last year, okay, a study was published from India citing that fragility hip fractures, or hip fractures in the elderly, actually has been coined as a pandemic within a pandemic, and that a multidisciplinary approach should be rendered for these patients in order to improve the overall outcome to survival. And a very popular slide is the old age dependency. It says that there will be a tremendous increase in the number of older patients in the next 30 years. So the challenge for the hospitals and physicians and orthopedic surgeons in the Asia Pacific region is, how do we deal with the exponential fragility fracture numbers? Given the change in the demographic structure, workers to support the elderly people, since most are diverted to take care of COVID patients. We will need more efficient prevention of fragility fractures, more efficient treatment in order for these patients, or the older patients, to have better return of function, and for them to have retention of independence if they suffer a fracture. Okay, so the problem actually lies in that older patients. In dealing with older patients with fragility fractures, we are faced with two problems, and we are more familiar with the biomechanical problem only, or as orthopedic surgeons, which is the fragility of the bone. But the equally important thing is the frailty of the older individual, which is a physiological problem. Frailty actually is a common syndrome in older people, consisting of physiologic aging, which means that they cannot tolerate common stressors such as injury coming from a fracture. There's the problem of muscle weakness, sarcopenia, cognitive dysfunction, which belies these patients, and also the frequencies. Nowadays, there's the term called osteosarcopenia, which we should address. Okay, so now, given all these facts, us orthopedic surgeons should know not only to manage the fragility, but also how to address the frailty. And with this challenge, we have to sort of collaborate with other subspecialties like a geriatrician, because our patients with fragility fractures needs both skill sets. And of course, the multidisciplinary team is bigger than that. It will include anesthesiologists, the nurses, the rehab medicine, physiotherapists, even the caregivers and the family members should be included in the team. But the key is having this orthogeriatric combination. Okay, so geriatric medicine is actually the branch of medicine that specializes in frailty. However, other physicians, most especially in physicians and family medicine physicians, can really acquire geriatric competencies. And the co-management by orthopedics plus geriatrics is what we call orthogeriatrics. And it has been found to lead to better outcomes in patients with fragility fracture, shorter length of stay in the hospitals, and it leads to reduction in complications and readmissions. Okay, so orthogeriatric co-management has a very potential for improvement in terms of shorter length of stay in the hospital, lower complications, readmissions, better restoration of quality of life, no? And most of all, especially now that economies of countries are really stretched out, no? Providing cost-effective care, no, due to cost reductions. And in these patients, the geriatric co-management principles can really be spearheaded by an orthopedic surgeon, no? Orthopedic surgeons should be leading the team approach from admission until the completion of the rehabilitation, and should not only be focusing on fixation itself. We need interdisciplinary care. We need co-ownership. We have to share the responsibilities in caring for these patients with fragility fractures, and be emphasizing on pathways of care, no, protocol-driven care. All the members of the team rendering care to these patients with fragility fractures. The prioritizing the patients, because elderly patients are like pediatric patients. No, they have many problems. Their immune systems are not that optimal, of course, and they have aging. Okay, so when we talk about orthogeriatrics, no, we are talking about quality standards embedded in the pathway of care, no, of orthogeriatric co-management, and some of these quality standards are, no, acute fracture care or acute surgery for these fractures, ideally within 24 to 48 hours, a joint care and orthopedics, no, a collaboration of the geriatricians and the orthopedic surgeon, a good pathway of care or assessment protocol, okay, a geriatrician and a multidisciplinary rehabilitation centered on early mobilization, weight bearing of these patients. Of course, fracture preventions, falls prevention, and also the recognition of pre and post-op delirium. Okay, so knowing all of this, no, in this next three graphs, which are only actually, these are raw data, no, and from the FRMAT, or the Fracture Care Mapping Survey Project, which the University of Oxford has run 2 years ago. We can see that among representative countries in the region, no, for which this survey was rolled out, okay, there's still many hospitals and institutions wherein the timing from admission to surgery is beyond 2 days. Okay, many hospitals have been rendering care, surgical care for these patients actually for 5 days. Okay, and a very important aspect of this management, many patients, no, are still not brought to the hospital within 24 hours. In fact, a number of patients seek hospital treatment, no, still beyond 3 days, and some beyond 5 to 9 days. So we really render orthogeriatric care to these patients if the issue of bringing elderly patients to the hospitals, no, because of fear of surgical treatment for these patients, really hounds the family of these patients. Okay? So in this survey, it was also shown that among hospitals, no, among representative countries in the Asia Pacific region, there are very few geriatricians. In fact, orthogeriatric care there's a difficulty in rendering orthogeriatric due to the lack of geriatricians. Okay, so we will tackle how can we roll out orthogeriatric co-management even with the scarcity of geriatrics in our institutions. So in all of this, what is the role of the orthopedic surgeon? Say, I'm not biased, but I'm just saying this, that orthopedic surgeons can really act as standard bearers of the multidisciplinary team. No, why? Because we are really the gatekeepers. We are the initial patient contact. We see these patients with fragility fractures. Therefore, we have the responsibility of initiating the team approach, because nobody else will do this. The responsibility for a better outcome is really one of the responsibilities of an orthopedic surgeon. And it should not be an excuse if hospital or our country is lacking in geriatricians, because in low resource settings, geriatric competencies or the ability to manage frailty can be taught to other physicians, nurses, and other healthcare workers. Okay, so in 2018, the Fragility Fracture Network released this call to action to promote orthogeriatric care. No, this was supported by many international organizations, including the IOF. In fact, no, one of the supporters or one of the regional supporters of this call to action is the Asia Pacific Orthopedic Association. Okay, and the call to action is hinged on the 4 pillars of the namely acute multidisciplinary care, rehabilitation, and secondary fracture prevention, which comprises the first 3 clinical pillars. And an important aspect is 4th pillar, which is a political pillar, which is the establishment of multidisciplinary national alliances. No, we believe in order to convert the call to action into actual action, multidisciplinary should be formed in countries. No, and these alliances should imbibe and should promote orthogeriatric care. So even if there are very few geriatricians available, geriatric competencies and the ability to manage frailty can be taught to other physicians, and we empower our nurses, no, because they can be our extension in providing orthogeriatric care. And thus, because of this challenge, the Education Committee of the Fragility Fracture Network is designing a web-based course, no, based on 2 existing assets, which may help you if you want to promote orthogeriatric care in your country. The first, I think this book was already mentioned by Professor Noor. Okay, the first is Orthogeriatric Book 2nd edition, which really gives the details about 4 pillars of the call to action. This was published in 2020 and has been translated to many languages already, such as the Spanish, Greek, Arabic, Mandarin, Russian, Hindi, and Marathi. So this will be a very useful educational tool if you want to promote orthogeriatric care in your country. The second source material will be the clinical and policy toolkits, no, which was also a project by the Fragility Fracture Network. In here, as I mentioned earlier, you will be given per each pillar, no, you will see how the pillars can be carried out, no, giving all the necessary resources and the information in order to carry out these pillars, no. And in the next few slides, I would like to just give experience in the Philippines, no. Since we rolled out, no, the orthogeriatric care co-management institution, no, we had a decrease in time from admission to surgery from 12 days to 5 days, a decrease in the length of the hospital stay from 19 days to 10 days. And of course, there was a 72% increase a management of osteoporosis, no, in patients having fragility fractures. And nowadays, because we saw this importance, we are rolling out, no, this newly approved program in which we will be having a multi-center implementation of orthogeriatrics in the fracture liaison service for elderly hip fractures in 14 public institutions in the Philippines, no, in order to expand orthogeriatric care and FLS in the Philippines, supported by a hip fracture registry. So hopefully, this will also help, no, the other institutions, not only the university institutions in our country. Okay. Important project is the Global Orthogeriatric Survey, no, the FFN Global Project, which aims to map the availability of orthogeriatric co-management, no, existing globally. This is sort of analogous to the Capture the Fracture campaign of the IOF for the fracture liaison service. The goal is to chart progress, identify obstacles, educational and policy needs, informing country-specific work, no, regarding orthogeriatrics. And the goal is to have the national FFNs catalyze the collaboration, no, with the educational committee FFN in order to promote orthogeriatric care in specific countries. And the regional meetings of the Fragility Fracture Network in 2022 will focus, no, on this care development. So in summary, the prevailing health condition and population aging is driving fragility fractures. Therefore, there's really need for multidisciplinary orthogeriatric to improve outcomes and to provide cost-effective care for these patients. Orthogeriatric care can be implemented even in non-ideal or low-resource settings, no? So if you have lacking in geriatricians in your country, you can still orthogeriatric care. Okay, orthopedic surgeons, no, should change the culture and should take up the challenge, extended role as the standard bearers of the orthogeriatric care multidisciplinary team. And the Fragile Fracture Network is pooling our worldwide experience of acute management and secondary fracture prevention to promote orthogeriatric care through national FFNs and hopefully through the Global Orthogeriatric Care Project. So thank you to my talk. And if you're interested in establishing a national FFN and promoting orthogeriatric care in your country, feel free to give me an email, to a personal email. Maybe we can help you establish a national country in order to support your orthogeriatric care services. So thank you and hope you learned something from my presentation.